couples support each other. I've been practicing for the last 30 years, and I've been mostly involved in corporate dealing with health issues. And it's my honor and privilege to be here with you today. At Chiromo Hospital Group, one of our key things is preventive, promoting mental health, and also curative. So it's my hope in this discussion we shall be able to interact in those three dimensions. Thank you for having me.
Thank you so much. Thank you, Dr. Ndoti. You're going to take us through the health issues. If you have questions, kindly you can type it on the chat, or you can raise your hand and ask after the session. Just to have order, kindly make sure your mics are muted so that you do not interrupt the session. It's a recorded session. There's some conversation that I know you'd want us to hear. So kindly just mute your mic and let's have order. Thank you, Martin. Up to you. Kindly take us through.
Sorry, I had a presentation, but I'm seeing I can't be able to share the presentation.
Just a moment. Let me just sort that out.
Yeah.
That's okay. Confirm you can now present.
Yes.
Thank you.
So I'd like to share my screen. So just a moment. Can you see my presentation titled Men's Health?
Not yet.
Okay.
Tauzi. Inil by 1500.
Okay, somebody needs to mute themselves. Can you now see my screen share?
Yes.
All right.
Thank you.
Yeah, so that's the topic I was requested to talk about. Now, when a topic like men's health is so broad that I was struggling a bit as to how exactly to go about it, because basically the disease or the issues that affect men, each and every one of them is a topic on its own. So I decided to just touch on the whole subject as a whole, so that at least if we have specific questions on the specific conditions, then we can answer them as questions. So men's health is defined as the holistic management of health conditions and risks that are most common or specific to men, so that we can promote their optimal physical, emotional, and social health. Yeah. So basically, it's a matter of looking at what are the issues that men suffer and how best can we address them. Those of you who are familiar with the Dalai Lama, he was asked what surprised him most about humanity. So he answered that man, because he sacrifices his health in order to make money, then he sacrifices money to recuperate his health. And then he's so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he is never going to die, and then dies having never actually lived. So that is the paradox of our modern world. So we are chasing this life, then we end up not actually living. So the idea of it all is not just looking at the diseases that affect men, but to look at what we call wellness. Yeah. So here is a slide that talks about the wellness improvement system model, because man is multidimensional. We don't have just one aspect. So there's various, there are various aspects to our health. So spiritual wellness is one of them, intellectual wellness, social wellness, environmental wellness, emotional, financial, occupational, and physical wellness. So granted, I might not be able to cover all these aspects, so we will be able to touch on them as we go by. So, but why men? Why is it so important that we talk about men? Yeah, or why is it important that today we are thinking this will be a good discussion? So, men are generally less healthy than women, and this is because of certain things that predispose them to that. For example, 12% of men compared to 7% of women usually smoke. There is 12% males more likely to drink daily as compared to 5%. Men are more likely to use illicit drugs. They die on average 6 years earlier than women. That is at the age of 76.6 years versus 82.6 years. Now that is an American statistic. I tried to look for a Kenyan statistic, and I didn't quite get a very specific one like that. And in terms of mortality, especially between the ages of 25 to 65, you find that's where most men are affected with things like intentional self-harm, including suicide. In fact, for suicide, men are at a 4 times higher rate of suicidality compared to women. Of course, things like transport deaths and work-related deaths, up to 90% of them affect men. And to make matters worse, and why I think this talk was initiated, is that men have a poorer health-seeking habit. So men rarely go to hospital until they are actually very sick. I remember yesterday I was also at work, and there's a gentleman who was brought by the wife. He has been sick for almost 2 weeks. And eventually now the wife is the one who had to bring him to hospital. So why are men like this? Why are we like this? It's because of how we identify masculinity as. Yeah, you know, there are things like, oh, men don't cry, or jikaze kimwanaume, all those issues. Yeah, so masculinity has been identified as the key factor that leads both men and boys to risky behaviors. So there are those behaviors that are thought to be of masculine or show masculinity. Yeah, so much so that until nowadays people have started referring to it as toxic masculinity. If it is raining, I would rather be rained on run than carry an umbrella. So masculine identity and behavior vary over the course of a man's life. They also vary considerably according to the cultural and ethnic background, sexual identity, socioeconomic, and or geographical locations. So men are more likely to be both perpetrators and victims of violence, because that is the other risk factor for why men also suffer a lot. So when boys are exposed to violence during their formative years, this contributes to a wide range of issues like homelessness, drug abuse, depression, relationship difficulties, crime, and many other aspects. I think there are still some people who haven't muted their mics, so there's some background noise from certain quarters. There are health conditions that only affect men, such as prostate cancer, because women don't have a prostate, and low testosterone. But we can broadly categorize the issues that affect men into 3. So there is the physical conditions, physical medical conditions. For example, we have high blood pressure or hypertension. We have diabetes. We have strokes. Prostate hypertrophy or enlargement, what affects mostly men from their 40s upwards, gout and other types of arthritis, obesity, cancer, and even deaths due to risky issues. Obesity is quite an interesting one because traditionally, all these other conditions, high blood pressure, diabetes, strokes, have affected men more than women. Obesity traditionally has affected more women than men. But unfortunately, nowadays, we are starting to see a change in which now men are quickly catching up with women as far as obesity is concerned. So 1 in every 3 adults currently is obese. That is, their body mass index is above 30. And it's really becoming a worrying trend because obesity becomes a risk factor now for all these other conditions, including the diabetes and the hypertension. Yeah, gout is largely due to our eating and our other lifestyle habits like excessive alcohol intake. Women are really catching up again on that aspect of excessive alcohol, but traditionally men have been known to be the ones who drink a lot, especially together with intake of other purine proteins like red meat. Then beyond the physical conditions, and that list is not anyway exhaustive. As I said, we are the time allocated, I couldn't really go very deep into each of those issues specifically, but I'll be able to answer any specific questions. We have mental conditions as well. Yeah, issues like depression, schizophrenia, mania and bipolar disorder, self-harm and suicides. Like I had already mentioned before, men are 4 times more predisposed to suicide than women. More women usually suffer mental conditions, but when it comes now to things like self-harm and suicide, men actually tend to succumb more than women. Yeah, a woman might have the ideation of suicide. They might even have attempts of suicide, but men tend to execute or implement their suicides more successfully, quote unquote, than women. Yeah. Then we have sexual conditions like erectile dysfunction, which unfortunately is happening to younger and younger men. Yeah, there was a time there was the erectile dysfunction used to be for men above 60 and all that, but now younger and younger men in the 30s, and unfortunately even in the late 20s, we are seeing women suffering from erectile dysfunction. And the other one is also, I didn't mention it here, is infertility, male infertility. Yeah, a couple has been trying to get children 2 years, 3 years, 5 years, 10 years, and then it is discovered that the issue is not actually on the woman, it is actually on the men. And as far as sexual or infertility issues are concerned, 38% of the time, it is usually a male factor that is contributing to the infertility. Then 35% of the time, it is usually a female factor. So you can see male factors are actually higher than women. Yeah, I remember doing a semen analysis on a 30-year-old gentleman who had been married for 3 years, a Maasai man, and they couldn't get children. And the wife in those 3 years had been investigated and they found everything was okay until somebody decided, why not investigate the man? And when they came, we discovered that the man had not a single sperm in his ejaculate. So he was literally shooting blanks. And that's the reason why they were not getting any children. And those issues are really becoming quite an issue. So many of the major health risks that men face, like colon cancer, heart disease, are actually preventable. Yeah, especially when they are diagnosed early. Yeah, the problem is now these men, like this gentleman you are seeing sleeping on the right side of my screen. Yeah, we are okay. We are just there. You know, our health-seeking behavior. We don't go for screening tests. Yeah, so that this disease can be found early and we can be assisted. And that is why I put this diagram over here. Maybe at this moment I can be able to ask somebody. I don't know, I can't see who is in the meeting or not, but anyone, maybe somebody can tell me, if you saw a cockroach in your house, what would you do? Anyone?
Maybe I can choose for you.
Yes, please.
If there's no
I'll kill
volunteer.
it.
Caroline Kelemia.
And I want to hear the
I'll
men
kill the cockroach.
especially. You said
I'll kill the cockroach.
Oh, you'll kill the cockroach. Thank you for that answer. Another answer, somebody else?
I will spray using Motain Doom.
Okay, you'll spray using Motain. I'm assuming you want to kill it, eh?
Yes, please.
Anybody who will do something else other than killing the cockroach?
I'll be
I will also check whether there are more.
Oh, you might check whether there are more. Somebody else?
I'll try to look for what has made them come to my house.
Okay, try to look for why they have come to your house. Any other last one?
I can see on the chat someone says they can make it for breakfast.
Great. Okay, sawa. That is a very morbid answer. But in China, I don't know whether that is a Chinese person. In China, they actually breed and eat cockroaches. Anyone who would ignore the cockroach? Okay, silence means no one. Yeah, you might opt to kill the cockroach, but trust you me, many a times when somebody sees one cockroach, most of the time, you don't even mind so much, especially if it is a small cockroach. Many times you'll just ignore it. And unfortunately, when you see one cockroach in your house, chances are that there are many others. So I like that the person who said that they look for whether there are others. Chances are that it's not just that one cockroach. Cockroaches are not solitary insects. They live in families. Now, the reason why I decided to use this analogy of a cockroach is because many times when there is one problem somewhere, it is an indicator of, or could be an indicator of other problems elsewhere. So that is why it is very, very important to be able to go for this screening and checkups. Because as men, we are really under a lot of problems. I had already mentioned high blood pressure. Most of the time, high blood pressure comes as a twin with diabetes, and sometimes even as a triplet with high cholesterol. Sometimes if you find somebody is having prostate problems, it could either just be the prostate is enlarged, as it happens as we age. Unfortunately, it might also be cancer of the prostate. Men, do we check our testicles to see whether they are okay? Do we even know what we are supposed to look for? Because cancer is really becoming a big problem, especially in our country. We've been tracking the COVID-19 numbers and deaths since the time it started in 2020 until now. We have about 3,000 deaths so far. Unfortunately, cancer kills over 25,000 people annually in Kenya, and most of them are usually men. Imagine 25 to 28,000 deaths from cancer every year, and we don't announce that on TV on a daily basis. That's how serious these conditions are. So what are the risk factors for any of these conditions? Now, we broadly categorize the risk factors into two. There is what we call non-modifiable risk factors, and then we have modifiable risk factors. So the non-modifiable ones are things like age. You were born at a certain time, you've lived a certain number of years. There's nothing you can do about that. I know our female counterparts are always saying how they are 18 or 21 till they die. But if you are born at a certain time and you've lived a certain number of years, then that is your age, and there's nothing you can do about it. And as we age, these conditions become we become more susceptible to these conditions as we age. The other one is gender. Today we are talking about men. Not just the fact that they are men, but also what comes with the male gender. As we already mentioned, some of the issues that come with the male gender. Genetics, if you have certain genes in your body, might predispose you to certain diseases. And family history. If there are people in your family who've had high blood pressure, diabetes, arthritis, even cancer, then your risk is higher than that other person in whose family there is no such history. The interesting thing is nowadays we are also seeing a lot of people coming with things like high blood pressure, diabetes, and you ask them whether there are people in their family who have any of those conditions, and many a times we are finding people with no family history of those conditions. So it means they are acquiring them newly. Then we might not be able to do much about the non-modifiable factors, but the modifiable factors are referred to as modifiable because there's a lot of things that we can do about it, and we'll be able to see later on. So this is largely due to the things we take. Yeah, we say lifestyle is what ladies used to call my dress, my choice. Yeah. So our nutrition, yeah, our physical activity or lack thereof, what we call sedentary lifestyle, our tobacco use, alcohol consumption, our levels of weight, including obesity, and then also this factor we call stress and burnout due to our modern world. So all these are the modifiable risk factors. There's something we can do about them to be able to reduce our risk of getting any of those conditions as men. I'm sure none of this is really new to any of us. We can be able to say this is something that we've had before. So I'm not telling you anything new, and we shall see these factors later on. But again, another question I'd like to ask. So on the right-hand corner of my screen, you can see a picture of a very nicely well-coated donut, chocolate donut, and then next to it there is an avocado. Yeah. So if I may ask, between the avocado and the donut, what would you prefer if you are to be given? I wish I could say raise your hands. Who would go for the avocado and why? Somebody?
I think myself, I'll go for the avocado. Not a sugary person.
Okay. Somebody else will go for the avocado for a different reason?
I'll go for the avocado because of vitamin.
Okay. I like your answers. Somebody will go for the donut?
I would go for the donut because the avocado is completely tasteless.
Okay. As opposed to the yummy donut.
Correct.
I really like that answer. I really like that answer. One last answer. Anybody else who might go for the donut?
I think Daktari, majority of the students will go for the donuts, only that they don't have courage to say.
Okay. Sawa. Thank you for answering on their behalf. Now, when it comes to our choices of food, in our modern world, there are two main factors that have been shown nutritionally to affect our choice of food. Yeah. The first one being taste. I like what somebody said, that the avocado is tasteless, but the donut, I assume they meant, is very tasty. Yeah. So taste is one factor that tends to affect our choice of food, and it's such a big factor that we don't realize. It's such a subconscious thing, yeah, as to why you go for one thing over the other. Most of the time, the reason why we go for junk food versus the nutritional food is because junk food generally tastes better than what we'd call healthy foods. Yeah, as somebody has just said. Yeah, I myself I do love donuts, but I also love avocados. For me, to overcome the issue of taste, I just sprinkle a little bit of salt, and that does the trick. So taste is one major factor that for us in the modern world affects our food choices, and that is unfortunately causing us to choose unhealthy options compared to, because the healthy options are not always the tastiest. Then the second factor is convenience. Yeah, I mean, if you want to eat a donut, you just maybe go to Baker's Inn or a supermarket and just buy the donuts and eat. Actually, for the donut, you eat everything except the hole in the middle. Yeah. But for the avocado, you first of all need to go maybe to a market or somewhere, maybe look for one that is ripe. Yeah. You have to have some special skills to determine which avocado is ripe. And even after you buy it, you can't eat it there and then. Yeah, you probably need to wash it. You probably need a knife to be able to cut it. You probably need a spoon, maybe to scoop it. Then even after you eat the avocado, you still have to contend with the issue of the seed in the middle and also the peel, because you can't eat the seed and the peel. So it's not a very convenient option. That is why even things like, for example, in the morning, yeah, the option of between eating bread and eating, say, something like sweet potatoes. Yeah, the bread you just buy from the shop, ready to eat. Sweet potatoes, you have to go to the market, buy them, come boil them for almost an hour. That is extra fuel. Then, if you are like me, you will not want to eat your sweet potatoes when they are hot, so you have to wait for them to cool down. Then you have to peel them, and it's just a lot of work. So those two factors, taste, convenience, are the ones that are really affecting our choice of food. So what do we do? Yeah, what do we do? So one, the first point I put there is NKT. Yeah, NKT is a term that I coined, and it's an abbreviation that means, forgive my French, it means nigger, know thyself. Yeah, nigger, know thyself. Yeah. So the men, I want you to tell, if there is any man next to you, I want you to tell them, nigger, know thyself. Yes. So you should know your numbers. Yeah. And here numbers is in some quotes. Numbers include what is your blood pressure, what is your sugar, what is your cholesterol, what is your PSA, you know, what is your weight, yeah, what is your BMI, yeah, what is your level of uric acid, you know, yeah, how are your kidney functions, how are your liver functions, yeah, because if you do not know where you are, it might be very difficult to be able to tell now, this is where I am, where can I go now? And also you need to know your family history. Yeah, what issues are prevalent in my family? Yeah, and then you'll be able to now make a step as to, so this is where I am, and if this is one number is not okay or the other is not okay, what do I do about it? Yeah, so that once you know where you are, then you can be able to navigate. You know, even if you are to use Google Maps or any GPS program and you want to go somewhere, most of the time it starts by asking you where you are. Yeah, so you need to give the GPS of your life a station or a position where we are starting from. Yeah, and the best way to know your numbers is, for example, coming for a health check. Yeah, you can come for a medical checkup. Yeah. Most insurances have that provision in your cover that you have an annual a provision for an annual checkup, 10,000, 15,000. Some people have seen a cover that had a checkup that had a provision of up to 44,000 shillings to be able to do their annual checkups. Yeah, so just come. Yeah, then maintenance of a healthy body weight. Yeah, along with a healthy diet. Yeah, so for the BMI, as we said, if your BMI is at least 30 and above, then it's not healthy. Yeah, and closely related to that is what we call the abdominal circumference. Yeah, so for men, the ideal abdominal circumference is 88 centimeters. You can even use a tape measure and measure this at home. Yeah, at the level of your navel. Yeah, if your abdominal circumference at the level of your navel is above 88 centimeters for a lady, then they are obese. Then for a man, it's 102 centimeters. Yeah. So if as a man you your abdominal circumference is more than 102, then you have excess body weight, and especially body fat, which is one of the detrimental factors. You need to get active to be able to lose this weight. And this, the recommended is at least 30 minutes of what we call isometric exercises, at least 3 times a week, preferably most days of the week. Yeah, things like jogging, running, swimming, cycling, playing ball games, anything literally that will make you sweat and increase your heart rate. Yeah, people usually ask me, what about walking? Yeah, unless it is brisk walking, whereby you actually feel the strain. Yeah, otherwise, if it's just a leisure walk, it's good for your lungs and all, but it might not do much for your weight. Then avoid toxins like smoking. For smoking, we don't even discuss. We just say stop smoking. Then there is excessive alcohol intake. Somebody will ask what is excessive. The recommended maximum is usually 2 units of alcohol per day. Yeah, a unit of alcohol is 10 grams of alcohol. Then you'll ask me, so now how much is 10 grams? I don't go to a bar or somewhere and tell them to give me 5 grams of alcohol. So if you look at any alcoholic beverage, especially the ones that are packaged, you'll see they are written the percentage of alcohol per volume. So you'll see something is written 4%, 5%. So when you see an alcohol that is written 4% or 5%, it means for every 100 mLs of that alcohol, it has 5 grams of alcohol, or 4 grams of alcohol if it is a 4%. So if the alcohol is 4%, then it means every 100 ml of that brand of alcohol has 4 grams of alcohol. So it means, for example, if the bottle is 500 ml and each 100 ml has 4 grams, then it means that 500 ml bottle already has 20 grams of alcohol. So the maximum you can take of that particular alcohol is that 1 bottle per day. Beyond that 1 bottle, then that is excessive. So that is how we interpret that. Yeah. Smoking, there is no level of smoking that is healthy. So smoking, we don't negotiate. We just say that you need to quit. Then we need to sleep, we need to rest, but of course not too much, because we also have obligations. So recommended at least 6 hours of sleep per day will be adequate. Yeah, 6 to 8 hours, as it is said. Most of us, because of jam and all these things, it might be difficult. Then we need to learn to say no. That helps with managing our lives. Don't be a yes man, saying yes to everything. Itakuwa sasa you've taken too much, more than you can chew. Yeah, and that contributes to a lot of burnout. Yeah, manage your stress and stay mentally fit. Yeah, men, unfortunately, we don't talk about our issues. We cry from the inside. We die with our problems. Yeah, as opposed to our female counterparts. Men rarely talk about their issues, and even unfortunately, the way we also handle ourselves. If a man talks about an issue, the best we can do is maybe buy them alcohol, or tell them to be a man, tough it out, and things like that. We don't really help each other out. I think that is where women survive longer than us, because they help each other out. Yeah, yeah. You can sing, you can cry. Men should cry. Yeah, but the way we are socialized is that men don't cry, and unfortunately, that contributes to a lot of issues, especially mental health issues. And I think Dr. Cleopa will talk about that in greater detail. Then we need to seek medical care early. Yeah, we should borrow a leaf from the ladies. Yeah, yeah. Let's not stay until issues have become too complicated. And now, as doctors, now we struggle with taking care of the issues after they have really escalated. Yeah, so let's seek medical care. The good thing is that nowadays I've started seeing men have starting to seek care early and to take care of themselves. Yeah, which is a good thing overall. Maybe we will also start living a bit longer. If you must drink, then drink water. at least 2 liters of water between meals or 20 to 30 minutes before and after meals, because water taken during meal times slows down the rate of metabolism. So water maintains the blood consistency, but more importantly, it's that it helps the body in getting rid of excess toxins, things called free radicals that are generated by metabolism, yeah, and just basically detoxifying our bodies, yeah. As long as your kidneys are working well and your liver is working well, you don't need any other detox remedies. Just take your water. Yeah, one of the things that I have formed a habit of doing is that taking a glass of water as soon as I wake up in the morning before I do anything else. It is very helpful. Yeah, let's go for screening. Yeah, for most of us who own cars, yeah, we take them for regular service. Yeah, every so many kilometers. Yeah, some people take them after 5,000 kilometers, others after 10,000 kilometers. You know, and that is a metallic contraption that, you know, can get an accident and be written off, and you get another one from the insurance. Yeah. Unfortunately for us as human beings, we don't have, once we are written off, that's it. We don't have second lives, and you know, you only live once is true. Yeah, we don't have spare parts. Yeah, so if we can be able to take our cars for service every now and then, why not take ourselves, yeah, for service, as it were, you know, regular or annual checkups. Very, very important. Yeah, I remember, I think at the beginning of this month, I took my car for service. Yeah, and the total bill was in excess of 18,000 shillings. Yeah, and that's just for my car, which I usually take for service every 5,000 kilometers or so. Yeah, 18,000 shillings, which I had to pay out of my pocket. Yeah, many times people say, oh, going for annual checkups is expensive and everything. If we can afford to take our cars for service, then we should be able to afford to take ourselves at least once a year. Yeah, and one of the best ways to be able to remember is, for me, I usually say I give myself an annual checkup as a birthday present. So on my birthday, yeah, or around my birthday, that's when I usually do my annual checkups, so that I know what my numbers are and to see the areas that I need to change. Yeah, and you know, we'll check your blood pressures, check your sugar, uric acid, cholesterol, do some cancer screenings, recommend things like colonoscopy if need be, and you know, discover any issues. Yeah, I remember a gentleman who came for a routine checkup when he turned 50. He was like, I need to go for a checkup. You know, and we found that there was an issue in the colon, and he went for a colonoscopy, and they found he had a cancer had started. Yeah, and because it was very early, it was removed, and he's alive and well today. Yeah, he didn't even have to undergo chemotherapy because it was very early, and that's just because it was caught early. But unfortunately, most of the time we go for our screenings very late. So even if we find the cancer, it's already advanced. So there is not much that can be done. So my altar call after this sermon to all of us is that we write down our personal goals of a healthy lifestyle and how and when we will apply it. Yeah, so that we make a wise choice, because you can catch a flu from someone, but you cannot catch health from them, because health is actually a choice. Yeah, so write those goals down. Yeah, and get somebody to keep you accountable for them, so that we do better. So I think I will end there with this quote by there's an old gentleman who used to be called Yaya Sabit. He said, wewe ni wewe na mwisho wako ni wewe. Yeah, I don't know how I can translate that to English, but it all depends on you, basically. Yeah, so thank you.
Thank you so much, Dr. Martin. Yes. Really, that was a very good session. At least when we were talking, I could ask myself, I think how we've been brought as African, mwanaume ni kukaa ngumu, and I think that's why our men don't go to the hospital. Like the one you've told us, bibi ndo alimleta hospitali. So you find that even when you're telling the kid, don't cry, mwanaume ali. So I think we instill this fear in their men as they grow up, and I think we should change on how we bring up our kids, because I think that's where the problem starts, so that we can help prevent these conditions. Because what we've had, many conditions, they are preventable, and there's something you can do about it. So I know most may ask, why are we talking about the mental health? But for example, a man who is suffering from diabetes, hypertension is one of the diseases that affect men. If you're taking those drugs for long, you may have a negative effect on you, like, why am I taking these drugs? Will I die taking these drugs? So Cleopa is going to take us through how those issues affect the mental health, so that we can prevent from going to depression and suicide. Dr. Cleopa, you ready? Thank you so much, Dr. Martin. As Cleopa prepares to join, we have the corporate service manager from Chiromo Hospital Group. Gladys, maybe you can introduce yourself as Cleopa, as you hand it over to Cleopa to take us through that.
I'm trying. You could assist me also so that I am able to share my screen.
Yeah. You're a presenter.
Yeah, I'm trying to share the screen.
Mm-hmm. Gladys, maybe can say hi as he prepares.
Sorry. Hi, everybody. You got me off guard. Anyway, good morning, everybody. My name is Warugoro from Chiromo Hospital Group. I'm the Corporate Services Manager, Chiromo. Maybe as Cleopa tries to set up, maybe for those who do not know much more about Chiromo, we have been in existence since 1997, and we operate with 3 locations in Westlands and 2 at Lavington. We have currently opened a level 5 facility at Lavington Mudangari Road, plot number 37. And what is new, or why we've come up with a level 5, we are trying to get into mostly the preventive and promotive bit of mental health that include mental health wellness checkups. We're also doing a lot of outpatient psychologist examination, just to let people know that it is okay to pop into a hospital, have a therapist session, say how you're feeling, are you fatigued, are you stressed with work, family, and such kind of things, and just have a touch of how then you can maintain your mental health wellness. I'm glad that just to inform you that we're operating also with outpatient and inpatient. You can pop in, see a psychologist, pop in, see a psychiatrist. We have Doctors Plaza on with 16 psychiatrists and 12 psychologists in-house. And we are also doing this just to normalize the conversation around mental illnesses, and just to try and reduce the stigma around it. Just as you know, and as I have worked in AR, I know, if you pop in and have some pills prescribed for you, then people start pointing fingers at you. Yeah? Like, hey, mother squeezy, can you make a decision and we listen to you? Or what's up? What's disturbing you? Is your family okay? Such kind of things. We want just for you to feel comfortable to tell your supervisor, by the way, I have an appointment with a psychologist, with a psychiatrist, and it shouldn't raise any alarm. Eh? And as being involved in such forums, and especially with AR insurance, you've really made us put the message out there, and we are very glad for giving us the opportunity. And we're just trying to say that we can do very many more with this, and also as we tell people, and especially even the insurances, that you can also consider, as you consider having the annual medical checkup, you can also attest with me that you can not have the physical bit when your engine, which is the mind, is not functional. So we'll also need to have a conversation around how then we even consider having a mental wellness checkups. such that it can be even annual for a corporate, for an insurance, and so kind of thing. What we reassure you or assure you is that you'll get this recovery in dignity, and of course with just as we adhere to the mental health practices that are evidence-based. I don't know if Cleopa, you're back?
Yes, I'm ready. I am sharing. You can be able to see my presentation because I've
Yes.
I see it.
Yep.
Thank you. So now we thank you so much for giving us this opportunity to discuss with you this important part. And I know Dr. has already shared a lot of the things that are more from the medical perspective. So for me, I'll just go through and make a connection between what Dr. has shared and what we have. So at Chiromo Hospital Group, we are celebrating 25 years of our giving service on mental health from 1996 to date. And that's why you see it's an important period for us. So this is the growth we have come from. We started in Westlands, moved to Braeside, and now we are in Bustani. All the three facilities are operating, and our aim is to provide mental health services with dignity. So our vision is dignified quality services, which we are aiming to give into the whole of Africa. And we want to pursue excellence in the things we do, and we have to look at what has been researched. So it's my hope, even whatever I present, I will be able to connect with some of the proven scientific research in the field of psychology. So I start by saying, for me, I'm a psychologist, and it's important that right now we are starting to appreciate that there is need of, as our doctors, the psychiatrists, especially in our institution, they are in the lead in making diagnosis, coming with treatment plan, especially for mental health issues. And then they have already seen the connection that when a diagnosis is made, for instance, for depression, from a medical perspective, the psychiatrist will also give supportive and intervention in terms of medication and also therapy. And this comes from the fact that even the first psychologists, people like Freud and people like Viktor Frankl, who is one of the people that I'm leaning on quite a lot, initially they were doctors, psychiatrists, and then they realized that apart from treatment, we also need to involve therapy. And so it's my hope in this discussion, we shall be able to start seeing the connection between non-communicable diseases and mental health, all other illnesses that require intervention by either psychiatric, psychologists, and they work closely with a physician who could be managing this type of illness. And then we shall now look at the man. And being a man and having grown up from childhood to date in Kenya, and maybe a part of Africa, I'm still a part of Africa and the world, within those years of my existence, I have seen some few changes in the way men take some of these things. And so it will be good for me to start by saying there is a little bit of concern, and it is important we have a discussion on how men can be able to accept certain things and also seek help. One of the things comes from the way we are, and it's good to appreciate the differences between gender and the way we've been socialized from childhood. There are things that are common in all cultures. Like when a young boy is born, there are certain things, even rituals that take place. And then from there, from childhood, young man is reminded to be a man. This is how you need to behave. This is how you need to react. And most of the times, the men are socialized towards being tough, being courageous, being able to withhold emotions so that they bring out the strength of a man. And with that, then when we come to mental health, mental illnesses, we can now start seeing the connection between the upbringing, the socialization, and even now the culture. There is a way young men are growing up and the culture, the society says men behave this way. Then also we see what is happening again in the world, the culture which has changed, because there is the tradition, the modern, and the modern, we have technology now, which is also informing us a lot. And young men and old men are being informed by that. So and then there are issues to do with our spirituality, religious beliefs. All these things, they come into play. And so we now can have a background of the man. And now this man with that background, if he gets ill, like for instance, he is diagnosed with diabetes, high blood pressure, cancer, or any other, like Dr. has already given us that background. Then, having been brought up and told, this is how as a man you need to react in difficult situations, then when illnesses comes in, the man may not easily accept that he is unwell and hence seek treatment, and when given treatment, be able to follow up. Be able to follow up with the treatment the way it's supposed to be. So in this, we need to start appreciating that background. Then we bring in the issue of mental health, where we now see the issue of depression. So we need to start now thinking about what are the mental illnesses. And they are grouped in very many categories. There is the mood disorders. There is also the ones that have to do with the thinking and the perception. And today we shall look at depression. You can see
sorry to interrupt, Daktari. Are you presenting anything? We can only see the first page of 20.
I'm doing the introduction and then the other ones I move a little bit faster.
Okay, sure.
Yeah, so now I'm coming to now this, which we have already presented, the issue of depression. So we need to start appreciating now with that background of the man, then when one is unwell and one has been diagnosed with depression, how is the man likely to react? So depression is not simply a temporary change in the mood or a sign of weakness. And that was the area I was trying to build up. And then we see that depression is a medical conditions, which has both physical and cognitive symptoms. A bit of researches have been done, like in the Western, and maybe we may need to now start asking ourselves questions. This is Canada, and in Kenya, how could it be that 1 in 5 Canadians will experience an episode of mental illness during their lifetime? Then 1 in every 10 Canadians will experience an episode of major depressive disorder during their lifetime. So with that kind, then we can ask ourselves where we are, the people who are, everybody who is participating in this forum. And it has been shown through many researches that women are more likely than men to suffer from depression. So we start going through the argument I started with. I started with that argument so that we may see how men and women have been socialized and what could be the reason. And then having that in mind, as much as men are fewer who are likely to suffer from depression, they are 4 times more likely to die by suicide than women. So I want to invite you, and I don't know whether there is anybody in the forum who could maybe come up with an argument on this. Why is it that men are 4 times more likely to die by suicide than women? Maybe you could choose any participant to react to that.
It's open. Someone to volunteer. A man. Elijah, maybe.
Thank you. Possibly going by the kind of the introduction that he has given us over, whereby, in fact, he has said that the rate of depression, for men versus ladies, the men are lower. Yet when it comes to the issues of suicide, then the men are higher than the women. My thought could be maybe in the reason of how maybe their upbringing is, as the introduction has gone, because mostly for us men, we will, of course, die or have our issues within us. And when they are within us, possibly even in our depression status, we are not able, of course, to manage it out. And the way now again to manage it out, other than speak it out, is just to terminate it. And that is why it becomes easier for possibly men to go towards suicide than speak it out. Just because of their kind of, or the way we have been cultured out. Possibly, that's my answer.
Thank you very much. And I am happy that at least the introduction, because even as I move through the slides now faster, that gives us a background, and I'll be able now to connect with what you have said so that we may start asking ourselves, what do we do? So what are some of the types of depression that we have around? There is, depression has got a number of levels. There is the severe, or where a doctor may diagnose as major depressive disorder. We have seasonal depression, postpartum, bipolar, dysthymia, bereavement. I won't go into the details of what each occurs, but you start realizing that as much as we are talking of depression, it could be at different levels. So the symptoms are the ones that it could be important, especially for us men now. Having cultured the way I introduced, then when a man has a depressed mood, it could be because of things that are happening in life. It is because someone is unwell. Then there could now come the interest in some of the things that people are doing. Then men are likely to compare themselves, to compete with each other, and may have that feeling of worthlessness and guilty. And then there are those things of, if a man has tried everything and is not succeeding, he can easily give up. And that feeling of helplessness, worthlessness might lead to suicidal thoughts, where someone feels like it's not important for me to continue living. And then there is the raw energy level, the lack of interest, of appetite, not eating, and increased sleep. All these things are normal. They are things that happen at a certain level to every human person who is living. But then, according to now the diagnosis, is when you have more than 3 or 4 of these symptoms and they are stayed for a certain period, then you can be diagnosed as going through depression. So the first thing is, how now is it related to what we said about men? And how do we differentiate? Then, even when it is diagnosed, how can men start having many interests, not just one interest? And how can we prove our worth? So those are the questions I want to put to men. Maybe after the end of this discussion, we may need to respond to that. And so what are some of the relationships now between male and female when it comes to depression? I would go to the different ways women react. And I would want you to request you to maybe do a little bit of study on gender, the differences, why even scientifically it has been proven there are certain reasons why men will respond in a certain way or behave in a certain way when they are given situation. And so even when a man has been diagnosed, and even when a man has got all the symptoms I'm referred to, there is a likelihood of denial and denial of those feelings because of the way the upbringing of the man, that you need to be strong, you need to be courageous, you are the one to protect the family, all that coming from our cultural background. So there is a possibility of pushing and not accepting that those feelings are there. Then they can also try to hide their feeling. And they may do certain things to mask. So there are certain behaviors that men do in order to mask those feelings that are related into depression. And not only depression, other conditions like anxiety or personality disorders, all that can be hidden because of the way the man has been socialized. And then in depression, there are certain things that are very common for men. Like for instance, physical pain, anger, and being irritable. So it may, in order to hide and in order to continue being the man, then there is a likelihood of the emotions. And then behaviors like reckless driving, doing things without planning. So there are several things that men do, and it is important to start asking a question. Why is this man doing what he is doing? So I won't go into details with the PowerPoint because of time, but you can see that even in World Health Organization has already accepted that there are mental conditions, some of them which are neurological and especially substance use. And it's at this point, I may want to request us to start reflecting on the reality of how men abuse substance. And most of the time it may come because of rites of passage, the way they are told to become a man, you have to do this and this at a given age. And that's why sometimes men may start abusing substance at a very early age because of that, some of those factors. And then the mental health conditions, they also have similar risk factors with non-communicable diseases, and they may appear at the same time. So then the other thing of mental conditions is that they can appear at any point of the lifespan, and at times they are chronic and they may require long life management. So what is the impact between now depression and other non-communicable diseases? For instance, diabetes and hypertension. So for those of us, they know there is a relationship. When hypertension, there is a likelihood of mood swings, especially things like anger. So there is that association between non-communicable diseases and depression, and more so anxiety. The anxiety is, for how long will I continue taking this medication? The anxiety could come because of, as a man, I am supposed to continue being strong, healthy. Now that one has to start taking medication like for diabetes or hypertension for a long time or for lifelong, then they have to start having difficulties with them feeling the mood. And so you might find someone who has hypertension and at the same time they have depression and anxiety. And it's very important to separate the two, so that as much as someone is receiving treatment, the physician, then they will need to see a psychiatrist who can be able to support in treatment of depression and anxiety. So we may not go into the details, but I think by now we already have an idea of that there is a relationship. And with that, then we look at anxiety and how it affects. After diagnosis of terminally ill patient, they might come up with feeling symptoms of anxiety. Anxiety is that not knowing what will happen tomorrow. And most of the time it depends on how, after diagnosis, the communication has been done. And then there is need for adequate care so that we can be able to avoid the anxiety becoming now an illness. And that is where now the support of psychologists, being able to give proper psycho-education. If it is diagnosis, what is the meaning of this diagnosis? What are the symptoms? What are the treatment options? And when we do that early enough, then we can avoid the possibility of someone having a mental illness related to, which is to get combined together with the physical illness. So the symptoms of anxiety might manifest themselves in patients who have trouble adhering to medication. And that's why now continuous therapy and seeing a psychologist who is well trained is quite important. So there is always that relationship between mental disorders occurring at the same time with other non-communicable diseases such as diabetes, cancer, and all this is because if we go back into thinking a little bit about the science of mental illness, there is that cognitive part of it. And I would want to refer, maybe we may not go into detail in this presentation, to the whole issue of neurotransmitters and the chemicals that affect the way we think. They are connected. And so when someone is already having this diagnosis or managing diabetes or cancer, then how does that person think about the illness? And that's where now therapy or talking to a psychologist or a psychiatric is very important, because of being able to manage and to cope with the illness. And so with that, I think we had a few minutes with us, and it will be good for us to open the forum for questions and further discussion. At the moment, we are starting a campaign, which is Tufunguke. It's saying my mental health first, as you can see in the pictures. So throughout this month, we'll be coming up with a different discussion, either on media or on our Facebook pages, in order to support people. So for any question, comment, or any support, please save our toll-free line number so that you can be able to call us. And these toll-free numbers has three purposes. One is psychological first aid, whereby you can call and in 5 minutes, you are assisted with whichever question you have. The second is to book for appointment so that you can come and get help. So we request you can have this number and share it with the people in your family. So thank you so much for having us. I hope I've been able to open up the forum and give a bit of insight. Thank you.
Thank you so much, Cleopa. That's very great presentation. At least you've related the correlation between the conditions and how it affects our mental health. I think the key thing to take is to prevent for the diseases to happen, because as the first presentation that about the cockroach, if you see one cockroach, that means there's others in the house. So if, for example, you find that you have a condition, if you've not been going for the checkups, you'll find that there are other underlying conditions that you've not yet known that you have, that you're already suffering from. Like the guy who went to the hospital at age of 15, they were able to find out there's a cancer that was growing up on the colony, and they were able to treat that. So prevention is key, and the earlier the disease is gotten, the better for the management of the disease. There's a question, so back to Dr. Martin, there's a question about you. If you have a question, you can raise your hand or chat it on the chat box. This goes to Dr. Martin. Does taking warm water instead of cold water help anything in metabolism?
Okay. Metabolism and water. So warm water versus cold water, there's not much of a difference. Of course, warm water increases the metabolism a bit more than the cold water, because now for the cold water, first of all, it has to be warmed by the body. So that one actually consumes some of the energy that would otherwise have been utilized for the metabolism. But warm water is already warm, so there is not much that needs to be done. So it's slightly better, but of course, for somebody who's not taking any water to begin with, they might as well just take whatever comes their way, but it's better to actually get warm water. Myself, I prefer the warm to slightly hot water. When I was growing up, you'll never have caught me dead taking warm or hot water, but nowadays, maybe age is catching up. I've been taking quite a lot of water, and it really does help.
Okay, thank you for that. I think that has been well answered. This goes to Cleopas. Can mental illness be categorized as a chronic condition, and can people get over mental illness without medication?
For that, thank you very much for that question. One, it is true. It's good, first of all, to ask ourselves what is chronic. And so chronic, there is that which can be cured. You have medication, you are treated, and within a short time, you are healed. So then, do we have certain stages? Like for instance, if it is depression, if someone comes with 2 or 3 symptoms and it's already known what could be the cause, because for all mental illness, there are 2 possibilities. The first one is genetic. Like what Dr. said, it could be something that is in the family, and you can go back to the family and you find that there are 2 or 3 members who had already a mental illness. At the moment, it's a bit tricky for our country because before, mental illness has not been taken so seriously. So we find you might not know whether someone suffered from a mental illness, but there are few questions that we can ask ourselves. Like for instance, if in the family there are people who had issues to do with alcohol use abuse or substance abuse, or those people who maybe they didn't have families or they had problems the way they related with the people. So you might see in that family, there is a likelihood that the behaviors that person had were the behaviors related to a mental illness, something like depression. So that is the first possibility of someone having that. You already have a possibility of having a mental illness. If that is discovered early enough and the diagnosis is made early enough, then someone is supported with medication and then combined with therapy, there is a likelihood that that person will manage to continue with the same illness, but it will not progress to severity. Like for instance, for depression, it may not go into major depressive disorder. Now, the other one is environmental, the way we handle the stresses of life, the trauma that we go through, the challenges that people encounter as they move from one stage to another, like in childhood, if someone was sexually abused. And for this part, allow me to say, because the discussion is about men, I know there are men who were sexually abused when they were young, and they cannot talk about it, or even they are not aware, because no one discusses sexual abuse among men. Even today, there is a likelihood that even as adults, someone could be sexually abused, but they don't know what it is. And so things like those ones that we bottle up and we are not able to talk about them, and it's like a taboo, because like the area of sex and sexuality is almost like a taboo. And for women, it's a little bit better. But for men, issues regarding our sexuality, there are things that we don't talk about. So there is a likelihood, because of bottling up, not dealing with most of the issues, then one can end up getting sick with the depression. And if it is discovered early enough, if the people are observant, if there is good awareness of mental health among us, and especially among men, so that we don't deny, we don't mask, then early diagnosis, early treatment is good for prevention. So it will not progress into chronic. But now the problem we have is you start feeling sad, and you continue feeling sad every day. You start withdrawing from people. You start not wanting to go to the places that you used to like. You are not feeling like waking up in the morning. And you have all the symptoms of depression. And then you still stay kama mwanaume, and you don't go for checkup. You don't go for support from the specialist. Then it might go now to severity. And at times, it may go to a point where we shall only manage the condition. And so when we get to that point, that's why we can now start saying this mental illness, could it be schizophrenia, depression, personality disorder, and we have not been able to treat it early enough, then it can go to chronic. Chronic meaning that you'll continue using medication for a lifetime, and even you'll be having frequent episodes. There are those people who come, they are diagnosed, they are given treatment, they respond well to the treatment. So theirs is only to take medication, come for review, and continue behaving normally. But there are those who have reached a point whereby they get medication, they get treated, but after a few days again, another episode. They get admission again, they are treated again. So we can generally say when it gets to that level where there are frequent admissions, there are frequent relapses, then someone is now on a clinical, on a chronic part of it. The same can be applied to substance use disorders, because this is something common with men. Alcohol, we start using. Then we may go to a level of tolerance where we are just having, we are craving, and it's compulsive. You look for the alcohol. But the moment someone starts shaking, someone cannot wake up in the morning and go to work. Kwa kijiji wanasema kufungua rock. And it happens even not only kwa kijiji, whereby someone has to take a bit of alcohol in the morning to be able to work. So that is where now you have reached psychological and physical dependence on the substance of abuse. And hence, it's like chronic. Chronic means that you have to get support, psychological, throughout your life. And then it moves to addiction, where withdrawal symptoms are seen and all that. So I hope with that I've answered that question, and thank you so much for that.
Thank you. Another question goes to Dr. Martin. Effect of salt in men's life and the difference between ordinary salt and sea salt. As you answer that, Cleopa, you can prepare to answer, is lack of appetite a mental illness?
Okay. Salt is the usual seasoning that we put in our food. Now, the effect of especially excessive salt in our diet comes in as far as our kidney function is concerned. And especially the issue is the, salt, the chemical name for salt is sodium chloride. So the issue is the sodium in the salt. Water usually follows, if you remember your chemistry or biochemistry, water usually follows the sodium wherever it goes. So when we have excessive salt intake, then we will have excessive water retention in the kidneys, because the kidneys reabsorb the sodium. So when they reabsorb the sodium, then they also retain water. Then that is likely to cause high blood pressure. So in fact, one of the things that we advise people when they come and they seem to be having borderline or overt hypertension is to lower their salt intake. And when we talk about the salt, the main thing we are concerned about is the sodium aspect of it. Because some people say, I don't take much salt. Yeah, but you find that either people are adding salt after food has been taken, so it is preferred that the salt is added to the food as it is being cooked. Yeah, because the sodium in the salt that is added on top is usually more bioavailable. So the diuresis aspects of salt becomes more when you take it as raw salt. Yeah, so that is why it is important that we reduce, first of all, the amount of salt we take, and if we have to take the salt, then let it be cooked together with food. That is why junk food often is not a good option, especially not just because of its effect on our overall health, but because for most of the time, for example, if I use chips, for example, you have to put the salt after they have been cooked. Yeah, so you see, you are causing harm to yourself on more than one level. Yeah, the junk food itself, and then now you also have to add the salt on top, which now causes more diuresis and causes more problems. And this is a major issue. But then beyond the salt as a seasoning is that most preservatives of food, or most foods that are preserved using sodium-based preservatives. So it is the kind of sodium that it's not coupled to chloride, it's coupled to other components. So you won't taste like it has salt. Yeah. So you'll find a packed juice is preserved using a sodium-based preservative. So the juice doesn't taste salty, but it has a lot of sodium in it. That is why processed foods are not the best. Yeah, because they have high levels of sodium. The recommended daily allowance of sodium in the diet or in the body is up to 6 grams. Yeah, so 6 grams is like half a tablespoon, yeah, or a teaspoon of salt. But most of the time we find we end up consuming more than that. Yeah, for example, one sausage has around 1.8 grams of sodium, one sausage. So it means when by the time you have taken 3-4 sausages, you are almost or already exhausting your recommended daily allowance for sodium in a day. So sea salt is healthier or better than table salt because its bioavailability is less, but still less is more. So let's learn how to reduce so that we do not bring about problems to our bodies that we can prevent, like now the high blood pressure and other issues. Thank you.
Thank you for that. You can answer together with this, Cleopa.
Yeah.
Is obsessive compulsive disorder, OCD, also considered a mental health? And what is the cutting line between visiting a psychologist versus a psychiatrist for normal checkup?
Thank you very much. I'll start with the question about sleep and also appetite. Generally, for all mental health illnesses, because of the relationship between either mood or the thinking process, because there is that either certain mental illnesses are in the line of thinking. Like for instance, the spectrum of schizophrenia, schizo, where there is hallucinations, delusions, and all this is because of the thinking process. So when the thought process has been disrupted, then there is a likelihood of not being able to get sleep because one is thinking and thinking and thinking. And then, like in delusion, if someone is feeling like you have persecutory, where you feel like other people want to cause harm to you, because of that, then you will not sleep. Sometimes appetite will not be there. The same thing with mood disorders, where depression, bipolar, all those that are connected to anxiety, because of now those raw feeling, they also have a pain in themselves, that pain that the only person who can be able to tell how it feels is someone who has gone through that condition. Now, because of that pain, because of that raw mood, majority of the people will not get sleep, sometimes not sleep at all for 2, 3, 4 days. So it is important, the moment someone starts not having sleep for a day, for 2 days, for 3 days, then that's the first symptom, the sign of a mental illness. And that person may need to now go for assessment by either a psychiatric or a psychologist, and then for the food. Now, there are certain interviews psychologists or psychiatric will carry out so that they may now broaden from not sleeping, from not eating, from not functioning, not going to work, not doing what you are supposed to do in the family, not doing your self-care, what else? And then for depression, we have the major issues now that could conclude this is depression, together with lack of sleep, not eating, being common among all mental illnesses. So I hope by that I've already answered the relationship between lack of sleep or sleep disturbances or sleep problems or eating problems with all mental illnesses. Then the second one is about obsessive compulsive disorder. Just by that one of disorder, then it is still a part of the mental illnesses. And obsession or compulsive is that repeating of something, and why you are repeating it, you can't tell. Like for instance, someone who is crossing the door, going to sleep, come back again, cross again, after 10 minutes have not crossed, or someone who is washing his hands several times, you wash, after 30 minutes, you go and wash again, you feel dirty. Now, that obsession and that compulsive, when it gets to a point of disrupting your normal functioning, you can't go to work, you can't do the family chores because you are always washing your hands, you are feeling like there is that. Then the moment it has effect on functioning, the moment the relationships are affected, then it moves to the line of mental illness or a mental disorder. I hope that one I've also answered briefly. Now, psychiatrists, first and foremost, they are medical doctors. Someone who goes through the whole training, practices, and after becoming a doctor, he goes now to specialize in psychiatry, being a part of the training that he had gone through as a medical doctor. So what is the role? After being trained, he is able or she is able to diagnose. That is the key thing, especially mental illnesses, because of that background of being a doctor. The second, he is able to come with the treatment, which has to do with the medication, prescribe drugs, and also monitor the response of those drugs. So that is a psychiatrist who is a medical doctor. Psychologists, they are now, is a new field, especially in Kenya, but in developed countries, there is a lot of development that has occurred. So for a psychologist, you are trained now in different theories of counseling or therapy, and together with all the other social things and theories, you also train. There are those who specialize now in clinical. Clinical as they understand, and they'll be taken through, especially by doctors and psychiatrists, to understand all the mental illnesses in depth. Other general psychologists, they also go through mental disorders, but may not go in depth of understanding if it is depression, what it is, if it is schizophrenia, what do you do? So when they work with psychiatric, the psychiatric now helps the psychologist who already has the background to be able to study, to understand the clinical part of it. So I hope with that, we can be able to, and then the psychologists are trained at different levels. There are those who are into counseling, depending with the number of years and the institution. There are those who are into now therapy because of, like, you have a first degree, a master's, a PhD, and then there is the area of specialization. There are those who are specialized in marriage and family. There are those who are organizational psychology, and you can also have a touch of each one of them, because like in Kenya, we may not have the privilege of having a specialty, because wherever you are, you may meet people with different needs. And so you have to know how do you balance so that you will be able to do it as a psychologist. So I hope I've given the difference.
Yes. Thank you for that. The last question goes to Dr. Ndwati. What can I do about erectile dysfunction, and what should I do if I have pain in my testes? Maybe you can answer that.
Okay, that's a good question, and it sounds like a very specific problem. So you need to be seen by a doctor so that we can do a proper history. We can do a physical examination, do some investigations so that we know exactly where you are at and prescribe the correct treatment for you, because there is no one size that fits all. There are many causes or there could be many reasons why you have those two issues. So I would recommend that you be seen by a doctor. You can come to AAR. I'm usually here Friday, Saturday, Sunday, Monday, or you can be seen by any other doctor so that they can be able to evaluate you properly, so that they can prescribe the necessary treatment if need be. Thank you.
Thank you very much. Thank you so much, Dr. Ndwati and Cleopa, for taking your time to take our audience through the issues that are affecting men and how they can combat them. We are very grateful for the information. For those who are asking where, if the presentation can be available, this was recorded. You can find that on our YouTube. So after 4 hours, you can go to our YouTube channel and you'll find the discussion there. You can listen and get to refer where you do not get understand. If you don't want to visit the doctor, in case you have any condition, you can see Dr. Ndwati at AAR Healthcare at George Williamson. If you want to reach out to Chiromo, then maybe Cleopa, you can display your contact as you display. So those who want to reach out to Chiromo, they can get the numbers.
So thank you. I'll try to attach what I display, but I could say that we are in Chiromo Lane. That's our first in Westlands. Those who are able to come to Mudibi Road, you are able to get help from that place. We are also in Lavington, and in Lavington we have 2 branches. We have Braeside, and we have Bustani, where I'm speaking from. So those are the areas that you can be able to get us. I'm trying to see whether I can go back to the sharing. Yes, I am there. Hope you can see the slide. And then you can be able to see the right side where we are saying Chiromo Hospital Group, that's our contact. The Bustani is in 37 Mudangari Road. You can also find through our website info@Chiromo Hospital Group, chiromohg.co.ke, and also you can go to our website, chiromohospitalgroup.co.ke, and our toll-free line number 0800-2200-0000. I hope you can be able to see that on the screen.
Yes. You can give your final remarks as we wrap up the discussion.
We are really humbled, and I feel we are humbled to have had this opportunity to be able to discuss with you. And we are welcoming you, those who have not yet visited. I know a number of people from the organization has come to our new premises. We would really invite you to come and see how we support our patients with dignity. And that will be easier for you to either yourself, your relative, or our client, we can be able to refer them here. So we'll continue partnering, and we are so humbled for this partnership that has been going on for a long time between ourselves at AAR and the other people who are present in this forum. So for men, this is our Men's Father's Day week. I would encourage us men to talk more about our issues, especially, and I hope that last question, we were able to bring it up early enough so that we could talk about men and sexuality. And since we have several things that have to do with like the electoral failure, being able to elect or maintain an election and all that. So it is important for us men to start opening up. And in case you find you have such a challenge, it's not only because you are weak, like the certain things, but you need to see a doctor like the way Dr. Duarte has told us. It is good to face it, a doctor, so that you can be supported. And also go to a psychologist and talk about this thing, because some of them, you can get some support and guidance on how to overcome those challenges. So thank you so much.
Thank you. Dr. Ndwati, your remarks, and if you can display the contact for, or how we can reach out to Williamson House.
Okay, my final remarks will be that that last slide that I said, wewe ni wewe na mwisho wako ni wewe. Yeah. Let's really take care of ourselves, because like I had said, if we can take care of our vehicles, then the least we can do is take care of ourselves. Let's not leave the responsibility to our loved ones. Then, as I said, we are at AAR Williamson on 4th Avenue, Ngong Road, on 2nd floor. But AAR also has many outpatient facilities. Basically, literally anywhere where you are, you can find a facility near you, and you'll find good people who will be able to take care of you. So let's take care of ourselves, and it will be good. Thank you.
Thank you so much. We are really humbled to have hosted you, Dr. Ndwati and Cleopa. We also thank you, the audience, for joining, taking your time to join and learn about the health issues that and how you can prevent them. As we've learned, prevention is key. And as the last slide for Dr. Ndwati has said, wewe ni wewe. It starts with you. It has to start with you. I want to go for the medical checkup. I want to go and find out how my body is. Because if nobody else will do it for you. It has to start with you. As the week has just started, it's Men's Health Week until Sunday, when we shall have the Father's Day. And at AAR Insurance, we are committed to ensure you're in control. So for all men who have joined from our social media pages, our customers, look out for the next webinar that will be done on Friday, only for men, because we want you to be to be in control all the time. So as you thrive in your wellness, we also want you to thrive in other areas. So we're inviting you for that discussion on Friday, 5 to 6, men only. So we are very happy to have hosted you and to have joined our conversation. Check out the conversation on our YouTube. If you've joined later, at least you can catch up on what you've learned. Thank you very much. And we wish you a happy Men's Week, that you can take care of yourself, and happy Father's Day in advance. Thank you very much and have a good day. Bye.